welcome everybody. You're here at Community Conversation. I have the great pleasure of being mayor of Athens-Clarke County. My name is Kelly Girtz. I've got some fantastic guests joining me today. First and foremost, we have Commissioner Ovita Thornton, my successor in District 9 and longtime school board member prior to that. We have Dr. Suzanne Lester from and I think I will get this right, Augusta University of Georgia Medical Partnership. It seems like that name changes every couple of years, but I think that's it right at the moment. And then we have Dr. Whitney Howell from the Department of Public Health and the Northeast Health District. So I'm really glad to have everyone here tonight. So I'm going to have everybody talk a little bit about their experience in normal times and then how that experience has pivoted a little bit in the midst of the pandemic, what everybody's perspective is through their lenses out on the street. And then in the latter half of the hour, we'll go ahead and get to some of the questions from members of the public that they've emailed to us. So, Dr. Lester, I'm going to go ahead and begin with you. We're so grateful to have you here tonight. We've been proud as a community for the work that you've been doing out on the streets with the mobile lab, and we'll certainly get into talking about that because I think that's an important component of Athens' response to the COVID pandemic. But Dr. Lester, talk to us a little bit about, in non-pandemic times, what do you do every day?
So thank you for having me. Normally, I would be teaching first, second, and third year medical students. We would have normally just wrapped up our year. And then for their first and second years, and then our third years, who are the ones who go out in clinics, would be still continuing on because it's a 12-month program for them. The other thing I would be doing is I run we call it the MPMobile Athens Free Clinic, which is a little bit of a misnomer because we have a van, but we tend to really pop up. And that's what we mean by mobile. We don't have like an exam room in the van, but we pop up in underserved neighborhoods that we've partnered with over the last 2.5 years or 2 years. And then for 8 years prior to that, we had been partnering doing free sports physicals under kind of a different name, but still through the university. So we were delivering primary care with medical students, faculty, physicians, and residents from both St. Mary's and Piedmont internal medicine programs in neighborhoods like Pinewoods, Hallmark, Parkview, folks in homeless encampments, folks through ULEAD, home visits with Mercy Clinic, supplemental visits for Athens Community Council on Aging, and other organizations like that, also in the school district at both high schools.
That's great. And was that a regional project? Were you kind of going throughout the surrounding counties as well?
To some degree, we would go out to Elbert County. We've been to Walton County a couple of times and Elbert County a couple of times. They do have some of their own kind of federally qualified health center type setups that help serve underserved populations. So frankly, we've had a ton to do just in Clarke County alone.
Yeah, no, I think part of the reality of all of our experience having been, either care providers or in my case in public education here for a long time is just realizing how deep the challenges are and how much energy and how many resources we have to leverage to sort of move the meter. So really grateful for your work all of these years prior to now. Talk a little bit about the mobile lab that's been deployed now in the midst of the pandemic. How did that come to pass? And then functionally speaking, what are you doing day in, day out?
So we had to kind of halt our primary care services because technically as a university asset, we come under the GMA inventory. And so we had to stop our primary care in-person services that we continue with our continuity via telemedicine. And so then we asked to be redeployed in conjunction with the ACC government as a GMA asset locally to do mobile COVID-19 testing in the same communities that we were already serving, since we knew that they were, for different reasons than folks who travel a lot, they were at high risk for COVID-19, especially because most of them continue to work as critical infrastructure. And so y'all made the request and GMA granted it. And so then we were redeployed as a mobile testing unit in partnership with the local Northeast Health District DPH units. And Whitney Howell, Dr. Howell, has been crucial in that, and another staff member, Lori Hanna, have been we're kind of the team that has gone out along with Dr. Leah Bruner from the medical partnership as well to do most of the testing that we do as our unit.
Great. And you mentioned Whitney, Dr. Howell. Dr. Howell, I'll bring you into the conversation. Talk a little bit just about your day job in public health and what transition you've had to make in this last couple of months.
Yes, hi. Thank you for having me. So for my day-to-day focus as the district nursing director for 10 counties, it's mostly focused on nursing protocol. So writing new protocols, implementing services within the health departments, whether that's rolling out a new service we're going to provide to the community, such as diabetes, or say PrEP, the treatment to assist to prevent HIV and those that are high risk. But since the COVID-19 pandemic, I had to kind of shift things dramatically. I helped to write a nursing protocol that we use locally so that the nurses can collect those specimens for COVID-19 testing. At this point, I do kind of work with our nurses out there collecting specimens for testing. When I can, I go out with Dr. Lester and her team because I greatly enjoy that work. And then really just focusing on education for the nurses so that they're providing the best care to their patients that we see at our testing site and providing them with patient education. Currently, the Northeast Health District is operating 3 testing locations. We have a permanent site in Athens-Clarke County that we've been operating for 10 weeks now. And we have a mobile unit that goes to various counties within our district. Currently, it's in Jackson County, but it has been in Greene County, Barrow County, and it will be going to Walton County next week. We try to rotate it about every 2 weeks so that we can reach those individuals that experience barriers to testing or may not be able to travel to the Athens area to get tested. And of course, we also work in conjunction with Dr. Lester and her UGA mobile unit.
And I spent a lot of time talking about how important that regional perspective is, just given even our normal dynamics where we have a little bit north of 40,000 people who come into Athens every day to work and almost 40,000 people who leave Athens to go work somewhere else. And certainly we're this shopping and dining and education and entertainment powerhouse. And so those just daily habits, those patterns are so important to understand if we want to think about the health of our human bodies right now and certainly our population at large. I left the office for about an hour and a half at noontime to go get groceries. So went to the mega Kroger over by Athens Tech. And, when you walk through that parking lot, you see probably more out of county license plates than you do in county license plates because people from Hart and Elbert and Madison and Oglethorpe are all shopping there. So, I think one of these things that I'm trying to emphasize again and again is that we're all in this together and that, if we want to be healthy here in Athens, we have to be thinking about the health of Oglethorpe County and Madison County and beyond. So, Ovita, I want to bring you in. You obviously have been so engaged in the community for so long in so many ways. I always joke about Patrick being the only actual Athens native on the Athens-Clarke County Commission. But in some ways, I feel like you have an honorary slot in that you probably have been a working professional in Athens longer than anybody else on the Athens-Clarke County Commission. So talk a little bit about coming to Athens. You came in the 80s, is that right?
Actually, I did come in the 80s. My husband is actually from Athens, if that counts for anything.
You get a pass there. That's like like an anchor husband,
yeah,
right?
I got my credentials. I'm real. So, and both of my boys were born in Philadelphia, but my youngest son is from Athens. So I've been here since '82. Got involved just in the community with my kids. When you have kids and you're trying to be involved, you get in everything. So that involvement just kind of evolved to where I am now. So That's me in a nutshell.
And here in the midst of the pandemic, you've been doing so much. I've seen the food service provisions you've been involved in, the outreach, the information sharing. I mean, all that is so valuable right now. Talk a little bit about how you've been spending your time here in the last several weeks.
Well, I'm really glad that I am on the call. I don't know if Dr. Lester remembers where she met me at, but I've got her name at our first community prosperity package meeting. And we thought we were going in one direction. Here we're going in another direction. I was really fascinated knowing that she had the mobile clinic, which was new to me. And so I had some bigger ideas of where we were going to go, but we got a little detour. But we'll go back around. Right now, I meet every Tuesday at 1:00 with the Neighborhood Health Center, Mercy Clinic, the Nurses Clinic, Spencer Fry, and whoever else is interested to talk about where we are week to week with the virus. I'm curious and I think Dr. Howell mentioned it in her comments about the groups that she's working with, and I know that the health departments and Mercy Clinic and the Nurses Clinic, they serve that population of people that I'm always concerned about, whether it's a pandemic or everything is well. So I guess my question, if this is the right time to ask questions, is how can we, or who is actually coordinating or bringing all of these pieces together in a concise and a very more effective way. I'm really impressed with all the work that I'm seeing. And I'm wondering if we're still missing people because it seems so scattered. I found out late on yesterday that the Sparrow's Nest, I found out at 12 o'clock that the Sparrow's Nest was doing free testing. It was over with at 12:45. But now I know they do it every Tuesday. I understand the health department is planning to do testing on Friday. So maybe the question now is, Kelly, how do we get that? And how do we, kind of organize that so we're not shotgun shooting?
And maybe I'll turn to Dr. Howell first and then Dr. Lester to talk a little bit about the coordination that is underway. And I mean, I think everybody recognizes that in the midst of a crisis period, there are going to be some challenges. And at least from my perch here at City Hall, one of the challenges is making sure that we're getting good information to all the people, making sure we're coordinating data. There are obviously many, many testing providers out there. So talk a little bit about that, Dr. Howell, and then we'll turn to Dr. Lester.
Yes, I mean, I definitely agree that one of the challenges that we've noticed is getting the information out to all the right people who need to know it and in a timely manner. Sarah Peck is our public information officer. I feel like she's doing an excellent job of trying to push out our testing information, but I do feel that we can continue to work on getting the information to everyone. I will say that for our Athens, it's a permanent testing site. We are running that Monday through Friday, 8:30 to 5 p.m. And anyone who wants to be tested can get tested regardless if they have symptoms or not. To go ahead and make an appointment, someone would just need to call our screening line, and that phone number is 706-340-0996. That hotline is operational Monday through Friday, 8 to 7 p.m., and on Saturdays, 8 to 5. And when anyone calls that line, we'll ask them some simple questions just to make sure that they're interested in being tested and to help to coordinate what would be the best testing location. If it's with one of our mobile units, maybe they have transportation barriers, so we could refer them to Dr. Lester and her team, or we can schedule them in one of our surrounding counties or our permanent site in Athens. our mobile unit, that one is Monday through Friday, 8 to 5 as well. And I may have forgot to mention that the Athens offers testing on Saturdays for half days for those that might have trouble during the week.
So, Dr. Lester, in terms of that coordination question that Commissioner Thornton brought up, do you see some very specific underserved communities, or do you see some components of the greater healthcare apparatus that could work a little bit more tightly together as the gears turn?
Well, so yes, always. Absolutely, yes. All efforts could be more coordinated. And the Sparrow's Nest, that was me. And we were there last week. So, one of the things that we're doing is that we are trying to be as nimble as possible, because we know that as soon as we find out, for example, that neighborhood A, we do a testing event and then get a positive result back, that even making the positive result phone call and having DPH do their normal contact tracing and all of that, a very effective strategy is to go back to that same neighborhood and test again. Well, if I've already scheduled back-to-back events that have been announced, then I lose some of the flexibility of being able to go back to a neighborhood that may be a burgeoning hotspot. And so some of it is that we have deliberately left it loose. Number one, so we can continue the door-to-door testing for people who don't have transportation or who are homebound. And those calls come into our hotline that the medical students answer with faculty physician backup, and then those get mapped. They get put into a little program. One of the geography professors, Jerry Shannon, has helped us with this. And so we get a map at the end of every day. And then we make calls and we schedule door-to-door testing as well, kind of based on volume. And so, for example, if we go out for door-to-door and folks will tell us they're going to be there, we confirm. And then today we had somebody who wasn't there. We waited 30 minutes. I'm already in a gown. I'm already in my PPE. I don't want to waste that PPE. So then we might call somebody like Sparrow's Nest and say, hey, we don't want to waste a gown. Do you have people around? We'll come test. And they'll say, Jamie will say, yeah, I've got like 24 people are here. And we'll say, tell them to hang out. And then we'll jet over there and we'll do testing. Because we know at this point with the mandate, thankfully, to be test everyone who wants testing, that then it's up to us to kind of get ourselves there. So that's part of what seems like a lack of coordination is actually us trying to be nimble. Although we are trying to have it so that we have at least 2 big events scheduled every week, tending to be Tuesdays and Thursdays for our bigger events, and then reserving half days for doing the door-to-door testing. And also, we typically will also do a Saturday. So our testing days are Tuesday, Wednesday, Thursday, Saturday, in part because of my other still teaching and clinical obligations. So absolutely.
I love the image of you just swooping in, it's like the Justice League, and what Wonder Woman and Green Lantern have just shown up all of a sudden to take care of the Sparrow's Nest. So that's great.
We try, but it's true. It's often doesn't do as much of a job of great notice. And I think now that there are so many options for testing, the fear of advertising too widely is less of a concern. The other piece of the coordination for me, which has always been what we've done with our usual primary care mobile clinic, is that we try to only advertise within the population we're aiming to test that day, because we know that we can stir up problems within neighborhoods if we come and then lots of outside folks come. Like, that's not necessarily fair to the people who live there. And so we will do more targeted advertising. And we have stakeholders in different communities that will help us advertise through WhatsApp and group text and things like that. But yes, we are trying to make some regular stops, specifically trying to reach the homeless community where telephones and addresses and such are not as consistent, so that we can have that advertised.
So as you've tried to do those sort of recurrent visits to some of the same places, have you found some hot spots in Athens or the surrounding areas?
Yes. I mean, they may not meet the technical term in epidemiology as a hotspot, but we are finding clusters of cases within communities. And there are people who have had contact, right, with other people in that same kind of region or household or encampment or workplace even. So
are there any trends that you guys are seeing in terms of that transmission? Are these family units, coworkers, close collaborators, friends?
It seems to all be close, either household. It all seems to be close contact, people who are spending a significant amount of time around each other. The question, and it seems to, there are no favorites. It seems like every community is vulnerable at this point. And what's interesting is the majority of people that we're having as testing positive do not have symptoms, or if they have symptoms, they're very, very mild, which I hope is a reassuring thing. I don't know how many people we're missing. Or, obviously there are people who are getting tested because they're presenting to the hospital. But what's always interesting is trying to kind of just mentally sort out, where did the index case first come into contact with it? And I think now we're the what is it? The horse is out of the barn. It's in the community. So
Yeah, and certainly that asymptomatic transfer was one of those realities that I think struck so many of us early on. And as I put my mask on every day to go about my business, just to kind of walk through this building to get to my office, or to go get my bananas today at the grocery store, I'm hoping that everybody continues to hear that, this may not affect me, but if I pass it on to somebody else, I can unknowingly harm somebody immeasurably.
right, exactly.
One of the things I was a little bit curious about, and I think Dr. Lester, you and I were on a call with some other providers earlier, is about the question of people's everyday medical needs. I think a challenge has been that in these times of understandable fear, people are deferring things that they need to be doing, whether that's somebody who needs to see the dermatologist just to make sure that they don't have the beginnings of a skin cancer, or somebody getting their mammography. So what advice would you give to the public around kind of those broader needs and just taking care of business like we all know we need to, month in, month out?
Right. So I think it's a very salient and timely point as people start to, I don't know if people are actually getting more comfortable about where we are in the pandemic. I personally still think it's a little too soon to get comfortable, right? But at the same time, not having control over chronic conditions is a setup for a worse outcome if you do get COVID-19. Not having gotten your vaccines for other preventable illnesses is also a setup for worse outcomes. Having an undiagnosed cancer that progresses also it gives a poorer prognosis. So now is not the time to miss routine immunizations. It is not the time to miss your chronic disease management appointments. It's not the time to miss cancer screenings. I think that now we have had time to get protocols in place for people to come safely back to those facilities that offer screening. And also that I work at the Piedmont Community Care Clinic as well, supervising internal medicine residents, and we are now doing both telemedicine and in person, kind of based on the patient's comfort level and our comfort level about, wait a minute, I'm really worried about your diabetes. We need a face to face. So people do need to do their best to stay on top of those conditions and trust that the facilities where they'll be going for that care are doing their best as well to keep everyone safe.
And Dr. Howell, of course, through the health district, one of the key pieces of work in the area over the last couple of decades has been through the Teen Matters Clinic. When you talk to folks in those clinics, do you see some particular challenges in informing young people who, we're the population I work with for over 20 years here, of why this is a real challenge, even when you're 17 and, feel like you're 10 feet tall and bulletproof?
Absolutely. I actually worked at the Teen Matters Clinic. I was the nurse supervisor there for 3 years. So yes, currently the nurse supervisor there has shared that initially in the pandemic, she was very concerned because the teens love to kind of come in groups. They like to kind of come with their friends for their healthcare visits. So instead of just kind of coming by themselves, there'll be groups of 6 to 12. So we very quickly kind of had to address the Teen Matters Clinic situation very early on, and even before our other bigger clinics, and really had to share with teens about practicing social distancing and what this means for them. And while they may or may not develop any symptoms, if they, contract COVID-19, that they could pass it on and share it with others that could develop some serious illness and complications. So, yes, that we did have to have those conversations early.
Yeah, I can recall being a high school administrator and having to let kids know that every time they wanted to go to Teen Matters, they didn't have to go in the size of a football team. That wasn't a necessary means of getting just up the block to Baxter Street. Commissioner Thornton, what else is on your mind?
I'm still kind of stuck with coordination, but I think that might be a conversation that we probably will not be able to resolve right now. But as the local government, I think that some of this information should not just be on our website. I spoke to May Walters about how we could get information on our website, but I think that we as the local government could probably create our own Facebook page, because people are doing Facebook more than they're going to Clarke County websites. And so even if we don't want people, be bombarded with people with testing, or we have a schedule, I think that letting people know where they go, because there's still questions about how much it costs. Do I have insurance? People are not coming for reasons. They're talking about why they haven't got tested, but they want to get tested. So I think as the local government, Kelly, how do we get the word out? How do we work with Dr. Lester, Dr. Howell, and making sure the best way the word is getting out? The other thing, I'm strictly community grassroots, so I'm not no meeting person and group collaborating. We just going to figure there's a problem. We just need to go in and fix it. And I know I have had several churches that have called me. What can we do? What can we do? I mean, Rhema has reached out several times, and they want to do something, but we do not have a plan or a recommendation. So I think the faith-based community would be very beneficial in this effort of not only getting the word out, but getting people tested. And my last thing, well, for now, my last thing is having a plan. Kelly, we need a plan for our employees, for all of our employees. We need a plan on testing and I know we are educating, but what are we doing for our employees as government officials? Those are things that we could do ourselves and cover a lot of territory, because again, when you don't have the symptoms, people think they're fine. I know we've changed our office hours and all of that. And I'm gonna save my last comment for later, because like I'm choking here. I need something to drink real quick. So
Yeah, and I'll share that one of our challenge areas has been those employees of ours who come into very close contact with people. The department here of our 1,700 strong employee crew who's had the most number of positive cases is our fire department. They, of course, are often acting in concert with emergency medical services and showing up as first responders on the scene. And obviously, in that context, you are right there in somebody's face. Let's talk maybe about some of those kind of high concentration areas, maybe by employment class. And I'm really excited about this idea that maybe we do use kind of some faith community partners to be a model for getting some care to people, or getting testing and getting knowledge to people. I don't know, Dr. Howell, do you have any thoughts about using that mechanism for some outreach?
Yeah, one thing I wanted to mention first is that the testing that DPH provides is completely free, and that's testing that Dr. Lester provides with the UGA mobile, the Athens testing site, and our other mobile site is all free. no charge, no insurance. We don't address those things. So that would be what I have to say on that point. In terms of faith-based organizations, you mean like forming a partnership to perform testing or like a volunteer for other priorities?
Ovita, what were you thinking would be the sort of most viable route to that sort of partnership?
Think that faith-based groups could be a site for testing. Faith-based groups could surely reach out to their memberships if nobody else to be tested. And those sites, especially if they're centrally, and I'm thinking particularly about Rama right now. Rama is in a mid-low income community. It's very well, people on that side of town thinks it's accessible, and they've called to help out. And I really couldn't give them any advice. It has to be planned. I'm not just suggesting open the doors and anybody who wants to do anything. Those are the kind of meetings that I'm interested. How do we move from A to B and be able to track what we've done? So if you're working with a faith-based group, I think it goes back to what Dr. Lester said about being able to go back. You know where these folk are. They're not a part of this fight against this pandemic. The average now, Dr. Howell mentioned, I'm glad she made it clear, the testing is free. But when I get calls about how much it costs, I heard it was $300. I heard this and heard that. I wouldn't have known that if Dr. Howell hadn't have told us today. So Kelly, I'm not going to put these on these ladies. I think that we as the local government have a mechanism to get the facts and get the facts out straight so people can be better directed.
No, I love the idea of just being more explicit ourselves through our communication tools, through our Facebook page, through our website. We've obviously put the phone numbers up and let everybody know the hours of operation, but to be really clear about the reality, this is a free test through public health, through the mobile lab, because I think a lot of people probably had seen, especially early on, some of the private providers charging $250 or $300 for tests. And obviously there's a range of tests now. You've got the, presence, and then the antibody test or serological test, as a lot of people have heard about. I also am thinking right now, all of you, a little bit about this connection between, COVID and general health, and maybe those faith-based outlets, and like you're describing, Ovita, could also be a place where we really double down on reminding people that those normal healthcare concerns are still concerns, and that we need to take care of those. One of the things that we certainly face in Athens, and this is true in so many of the neighborhoods mentioned, and certainly throughout the South, is that there are higher rates of diabetes, higher rates of obesity, higher rates of hypertension, all of these risk factors. And so sometimes when people have, through email or phone calls, confronted me and said, why on earth are you so concerned about this? This is a college town. We're not going to get it. We shouldn't worry so much. I have to remind people very quickly that, once you move beyond the sort of rosy confines of Millage Avenue, you see, such a layered, such a diverse community, and a community that does have some very distinct needs that certainly all of you are familiar with and know so much about. Thinking a little bit about residual impacts of the pandemic. Dr. Howell, Dr. Lester, are you seeing some other community challenges, whether that's about food security or other things? Is anything coming to mind?
Well, we definitely, one of the things that we're working on with the medical students is for example, if somebody, so we know that if in the screening form we ask if they're symptomatic, mostly because we want to be able to advise them more specifically about self-quarantine if they're symptomatic. And we're asking the students to also ask them, do you have what you need to self quarantine? So, and then, for example, if we get a positive result, when I call to give a positive result, actually, I recognized one of the patients from another setting, and I was like, is your rent going to be, do you have enough money for rent? Do you have food? We need you to not leave the house. All of those things. And we were able to, it's in an informal network, but we were able to set her up with all of the things that she needed. There are other communities. So, for example, at Pinewoods, there have been donations through the Catholic Fund, Catholic Service
Catholic
Fund.
charities, yeah.
Thank you. To help people be able to shelter in place and to self isolate if they test positive. So I know that there are small examples of that. One of our goals is to build in kind of a short needs assessment and to be able to, over time, because we think this is going to go on for quite some time, right? Is to be able to have where the person on the end of the line doesn't have to hang up and call another number, but that we can literally transfer the call to somebody who could then say, okay, you need food delivered to you. What's your address? We'll do it. And so within the UGA network, we're trying to work on that because there's Campus Kitchen. We also have Food Bank. We have all of these graduate students wanting to serve. And so we're trying to figure out, we're working with some other faculty to try to figure out how to do that and utilize and coordinate the services that already exist in Athens and target them towards the people who need them most right now. But that is also, again, like we're still in a reaction phase of the pandemic. I feel like we are not yet in that management phase. And so I just feel like we're still just treading water to a certain degree. But yes, we're seeing that.
And I've referred lots of people to the ARC or to Action Incorporated for utility assistance or through rent assistance, but we know that that's limited right now. And what I've been saying all along is whatever is true normally is more true now.
Right.
If there's a community that's challenged, they're more challenged. If people are normally hungry, they're really hungry. Well, let's talk a little bit about those out months. When we think about moving from crisis response to management, for any of you, what are some of the things that you see as we move through the summer, as we move into next autumn and next winter, are going to have to be true for community health to be at its greatest point possible, regardless of whether a vaccine gets distributed in January, May, or July next year?
That's a big question.
So this obviously some simple things. We talked about mask wearing. What would you like to see be true in the public when you walk around?
I mean, I think for me, the thing is the masks right now is that it's hard for me to witness people not wearing a mask because it feels like it's a statement that they don't care. That's me assuming a lot. I don't mean that. I mean, I'm sure there are people who don't have access. We give a free cloth mask to everybody that we test, anybody that's right there with them. And I feel like the people that we are testing are actually very aware of the need for masks. And the reason they're getting tested is because they're afraid, and they're appropriately afraid because they're in higher risk categories. What I don't see is the people who seem to not be so worried, they're not wearing the mask. And it's sad because the high risk person is actually protecting the low risk person, right? Because it's the high risk person wearing the mask. And so I really just wish we could get in that collective mindset of looking after one another by wearing the masks. And keep a unified message on that. And then the next thing is that at some point I would imagine we'll have to integrate kind of COVID screening back into primary care because we need people to keep up with their primary care and to keep up with their health maintenance. And so at some point, all of the testing and everything is likely going to need to be integrated into the regular primary care clinic setting with kind of a COVID stream and the primary care stream.
Well, and that even gets into one of the questions that we had, which is about students who, some of whom are in town. This is college students, some of whom are in town, and certainly many of whom will be returning in August. I've reached out to the university and said I would love to see that every university student who comes into this community, who's taken classes this fall, gets a care package that includes a couple of masks. And Commissioner Thornton will be hearing tomorrow evening during our budget talks that, we have the prospect of a community-wide mask distribution possibility. We've distributed them now to all our employees. We're going to target our high concentration areas like our transit facility and our courthouse. but then ultimately I'd like us to be outside Walmart, making sure that everybody in the community has a mask, just so that it's absolutely ubiquitous. So what would you hope from the 19, 20-year-old community to see by August?
I mean, the same thing. I feel like that what's good enough for the people who live here year round ought to be good enough for the people who live here 9 months out of the year, right? So my hope would be that as undergrads and graduate students return to campus, is that they behave as though they are residents of Athens-Clarke County and continue with the mitigation efforts that you began in March. And it shouldn't be a controversy at this point. Governor Kemp recommended that everybody wear a mask when they're in public, whether they're high risk or not. This is not a controversial statement at this point. So my hope is that the messaging will get through to that population. I don't know, maybe Dr. Howell, because she deals with a much higher concentration of teens on a regular basis, if she thinks that that's possible. I don't know. What do you think?
I definitely think it's possible. It's all in the way that we provide this education to individuals and share that it helps to protect others. Even if you don't have symptoms, it's important for you to wear the mask. Just in case you are positive and you do not have symptoms, it protects others. I think it's very important. And in our testing sites, we also give a mask to everyone that doesn't have one who arrives to be tested, and provide that education so that they can share it with others. And hopefully it gets out to everyone. I know when I go out, I do see individuals wearing masks, but there's still that one or two that you just wish you could go run out and give them one, just because it's important. And it's going to be important as we continue through the summer.
And certainly, to the governor's credit, maybe counter to some other leaders who we've seen floating around the television screen. I was reading the news a little bit before this program started, and I saw that he was in Macon today, and he was wearing a mask. So, you've seen us certainly even on our commission meetings, kind of beginning with our masks on, and that I think everybody understands continues to be important. And I did have a question about a resolution from the commission to wear masks. One of the things that is underway is us coordinating with the university, with the Chamber of Commerce, with the health district, with Athens Technical College and others, to make sure that there really is common messaging. And one of the pieces of that messaging that's going to be rolling out in the next couple of weeks with appropriate signage and pictographics and the like will be, wear that mask and socially distance. And so we hope to see that on every restaurant door and every store door, and just in the faces of those that we pass. We, in an earlier commission resolution, encouraged mask wearing, and I think you'll probably see that reiterated, particularly coupled with that mask distribution effort that we can be a part of and spend some local funds on. I had a question about the safety of outdoor versus indoor activities. Dr. Howell, Dr. Lester, I don't know if one of you wants to address that. I mean, that's something that as time has gone on, it seems as if infectious disease experts are talking a little bit about, just in terms of being indoors where there are many, many surfaces and you're in a compressed space with an HVAC system over you, versus being outdoors. Could one of you talk a little bit about the relative safety of those two kind of environments?
I think regardless of the environment, it's still important to maintain that social distancing, that 6 feet from one another, and continuing to wear your mask. I will say that we operate our testing sites outdoors for a reason. And I think it kind of speaks to having that sunlight on these testing environments and being out in areas that it will help to slightly decrease the ability to have spread. However, it's still possible being very close to one another to spread COVID, regardless of what environment.
Yeah, and I think I get as much of my information from the news as medical journals at this point, because of the speed at which the data is coming out, and it does seem relatively convincing that outdoor activities, if done with appropriate social distancing, are your lowest risk. But that means with appropriate social distancing. Again, it always means that. It doesn't ever mean cheek and jowl or shoulder to shoulder. And so I think that's the thing to caution about the Memorial Day weekend images that we saw from other states where people were packed into pools and at beaches and everything. you're still exposed to somebody else's sweat and droplets and all that other kind of stuff. And so I think that that's very concerning, but I do think that people should be exercising outdoors, but just still maintaining that distance. And of course, if you're symptomatic, you shouldn't be outside, right? So you should be home on self-quarantine.
Yeah, and somebody did ask about potential spread at pools. I mean, I think we probably saw the images from the Ozarks and Florida and other places, and it scared the bejesus out of me. Very early on in this, of course, we were coming out of the Clarke County School District spring break and UGA's spring break, and friends with a couple of mayors in Texas and in Austin. One of the sort of super spreader events was this gaggle of kids who'd all vacationed in Mexico together that week before. And so I, saw those images over those last couple of days and almost saw like a sequel to that. Talk a little bit about the availability of antibody testing and for whom you would recommend that and under what circumstances. Would you recommend that to high risk people more than the general population?
I'll be first, and then Dr. Lester, you can jump in. Yes. So I would say at this point, the Northeast Health District is not offering antibody testing. I think there's still some concerns with that route. It's definitely not utilized or should not be utilized for diagnostic purposes. That's why we're providing the PCR-based testing to diagnose someone with COVID-19. I do think it has some value, definitely as a survey mechanism. And I know that Fulton County CPH is working on a study surveying individuals using the antibody testing to determine the prevalence of past infection. I think there's still a lot to learn about it. And I think that's what we'll learn through these studies is, does the antibody testing, if you're positive, does that mean that you are immune from COVID, that you've had it before? Does that mean that you can never get it again? And that's something that we don't know. And if you did have it and you have antibodies and it means you're protected, how long are you protected for? That's something that we do not know at this time.
I would agree. And I think the big concern too is that especially the rapid testing, there seems to be quite a bit of variability in terms of the actual number of false negatives and false positives, and how you use an antibody test is really how many people you use it on and whether or not you have a high index of suspicion for those patients. Changes actually kind of the perception of your false positives and false negatives. And so I feel like we don't have enough information to use it well at this point. And I think that I would hate for somebody to have a false sense of security. It would be nice to know if some of these folks that had COVID-like illness that were flu negative in February, it would be so great to know, was that COVID back then and for surveillance purposes. But again, I just don't think we're there yet. And so I would hesitate for people to rely on that to change their behaviors at all. That would make me nervous. So I just think we're not quite there yet, as much as I wish we were.
That makes sense. There's so much that's evolving, even in conversation around what a vaccine would look like. It seems like in the last couple of weeks, the suggestion had been that this will probably be a couple of shots. It's not going to be a one and done. Couple shots in succession seems to be the expectation at this point.
Mm-hmm.
Commissioner Thornton, we're getting relatively close to the end of the hour, but I wanted to bring you back into the conversation. As you think about the communities you work with, as you think about the challenged communities that have always been kind of the foremost of your mind, I think you should be proud right now, given the relatively low infection rate in Athens, even given the number of challenged communities and given the high poverty rate here. I look at those numbers at least twice a day, I think, like so many people do, and to see that, we're at, under 200 infections per 100,000 in the population, and you see, higher levels in Macon-Bibb or Columbus-Muskogee. I mean, and certainly, obviously, those hotspots that we talked about earlier. What are you hoping for in the months ahead, Ovita?
I before this call, I did talk to Commissioner Edwards, and this is his issue, and it is, even though you gave that report, knowing that New Zealand is zero, and they the same time we sheltered in is when they did what they had to do for their country, and they're at zero today. We still have a long way to go. I still don't think people take this serious enough. I don't think that I don't think that people really take this as serious. The things that I would like to see us is, based on all the stuff that we don't know, I would like for for us to work together on some regulations or some guidelines. I got a call again this weekend. Personal care home uh, provider had a case. She didn't know what to do, and she didn't know who to call to disinfect. We need to be able to help those small businesses to maneuver some of this stuff. Um, uh, I think that is really important. And I know there's meetings going on and on and on, but there still needs to be one place, or a place that we can, a reservoir of information. I couldn't give her no help until Tuesday, of who to call and where to call. So that's one thing. The other thing, I think that, and Dr. Lester, I know, has talked to State Representative Spencer Fry about a pilot program. Healthcare is not going to be the same, no matter what. Education is not going to be the same. Commerce is not going to be the same. This mobile clinic idea is going to be one of the things that I think is going to take off. And while we have Dr. Lester, and blessed to have Dr. Lester, we need to look at what that really looks like. And I think, again, I don't ask anybody to do anything that I'm not willing to do. We have opportunity with our funds from the local government, Kelly, on how we can take the lead on this new frontier of healthcare, not just with the COVID, but all those other conditions that Dr. Lester has mentioned. So we need to really seriously take that in consideration. And the last thing I would, I guess, just in closing, and that could be from any of our pots of money, Kelly. We just need to decide this is the change, and we're up for that change. And the only other thing I would like to see is, one thing, Dr. Howell, I did notice in Watkinsville, off of Elfsbridge Road, there's a billboard, and it really talked about what you just mentioned about the contact number. But I haven't seen a billboard in Athens on where to call. Maybe maybe that's something else we both can do collectively. We're putting up billboards, but there are those signs that we have in the yard sign. It really is like reminding people not to wash their hand, but a billboard with information on where to call. So the things that I would like to see: more collaboration. I'd be glad to help anywhere I can. Keeping in mind what happened in New Zealand, more information and billboards from the Department of Health, and start the planning and the local government working with the health professionals on this new direction of how healthcare is going to be provided in Athens-Clarke County. Thank you.
Yeah, I couldn't agree more about hoping for some different healthcare outcomes in the months and in the years ahead. I mean, I've said to a lot of people, certainly to members of the press, I mean, it's my hope that this really indicates how important healthcare is as a sort of a foundational asset in everybody's life, just as foundational as kindergarten, and hopefully equally available to everybody. And I would love to see us be sort of in the front of that sort of train of transition. So I had one more listener question that I forgot to get to earlier, and then I'll just ask for some closing thoughts from each of you, Dr. Lester and Dr. Howell. I think, Dr. Lester, you may have been engaged with the jail for testing there. Talk a little bit about that.
So we actually were not. My understanding is that the medical director for the jail is the former medical director at Mercy Clinic. And that DPH has spoken with him, and there was some other testing. So I think Dr. Howell will know better. I wasn't, though.
No, that's all right. Dr. Howell, have you had those conversations?
Sorry, I wasn't involved in that process.
Okay, we will follow up on that for the listener. Dr. Lester, Dr. Howell, I want to give each of you a minute to talk a little bit about what you hope to see on the road ahead in these coming months.
Whitney, you want to go first? You want me to go first?
Go ahead, Dr. Lester.
Okay, all right. So I like what Commissioner Thornton is saying. I feel like my preferred mode of healthcare delivery is mobile. I'm trying to co-opt some of my DPH team members to create our dream task force because it works, and folks are really happy to know that you're willing to come to where they're at. And we plan to continue that with our regular AUUGA MPMobile Athens Free Clinic as soon as we're allowed to restart our primary care operations as well. And my hope is just that, if nothing else, that folks in this community recognize that there are folks out there who do care about them, and that a great way for people, even outside of the medical field, to show that they care about people is to wear a mask. So I think that's, and our phone number, for our hotline is 706-308-4092. And ideally, this is for folks who have transportation challenges, because those are folks who aren't going to be able to get tested otherwise. But we will also coordinate with organizations to do testing for high-risk folks at their site outdoors.
Dr. Lester, could you give that number again?
Sure. 706-308-4092.
Thank you.
You're welcome.
Thank you, Dr. Lester. We're so appreciative of your work. Dr. Howell, you are going to get the final comments tonight. If you had to paint a picture of what the road ahead is like, knowing on the front lines how challenging it is at the moment, what would you like to be true through this summer and into this autumn and next winter?
Right. So our current public health priorities continue to be continuing to ramp up our testing. Right now, we have tested 4,000 individuals in our district. So just continuing to ramp it up, increase the availability of testing, and reduce any barriers that anyone will experience. Additionally, is just ramping up our case notification and contact tracing so that we can ultimately prevent the spread and really reduce the spread of COVID-19. So from a public health standpoint, that will continue to remain our priorities, and just making those adjustments and changes in the health department setting so that we can continue to provide care, birth control, hypertension medications to our patients in the community during this pandemic. We also have that mobile unit that we are focusing for testing right now, but I would love to partner up with Dr. Lester further in providing care to individuals in any means necessary.
Well, Dr. Whitney Howell, Dr. Suzanne Lester, Commissioner Ovita Thornton, I can't thank you enough for being here. We will not be joining you at Community Conversations next week because we will be in another budget meeting. So fortunate are we. But 2 weeks from tonight, we will be back with Community Conversation. And I intend to be here with a couple of recent high school graduates to talk about their experience working through this last semester of their high school life and into their future experience. So everybody be safe, have a great night, and we'll talk to you soon.
Thank you.
Thank you.